So it looks like we're letting some people in here, get everybody dialed in and earbuds on and ready to go. But looking forward to the discussion, Nelson. It's gonna be good.
I'm as well. This is this is going to be, I think, eye-opening for some folks.
Excellent, excellent. Yeah, I flew across the country to get back in time to host this one. So I know we had to move the date for the. I think originally we were looking at last week, and then they moved the meeting or something, but we made it happen.
You know, you probably could have just stayed where you were and found another fireplace to get in front of.
I probably could have, but I was as mentioned before we went turn this thing on, but New York, it's fun to visit. I'm more of a country kid, so I like having a horizon and I guess fresh growing plants around me. But it was fun to get out there and have some dinners and had a pastrami sandwich. That was pretty tasty.
They've got great corned beef and pastrami in New York City.
Yeah, no, it was on my to-do list. So Scott and I went going. It was actually fun. I don't usually get to travel with Scott, so we used to spent tons of hours and days together when we are building the company, but now we've got a little more help than we used to. So it's not every day we get to fly together. So it was kind of fun flying out and spend some time together. Took a few pictures for remembering what it was, what it used to be like. But all right, we are 11:01. It's Lindsay. Why don't you go ahead and kick this over to the intro slide, and then we'll tee things up here. But for those that are just joining, welcome. We have the June Fireside Chat. And this time around, I got Nelson Griswold with me, which I think it's your first show with the Six Degrees Fireside Chat, which
It is
blows
my
my mind.
first time around the fire with you. Yes.
Yeah, well, I guess it is the first time, but probably won't be the last time. I can't believe you snuck by without me getting you on here. So Nelson and I have known each other for a long time. We've been longtime sponsors of Ascend and all the initiatives that he has put together to educate the advisory community out there. And we're fortunate to have him today to do the same for the digital audience. So we record these shows. You can watch this and all the past episodes on our website. I'll put the link in the chat as we get going here. But Nelson, pleasure to have you. I do want to let the audience know that he will be hosting Ascend in Salt Lake City. And I want to thank you for doing that closer to me. Usually I feel like I'm flying to Atlanta or someplace, Nashville, Nashville's a fun one. I'll give you credit there. But this time we're in Salt Lake. Was it July 7th through the 10th? So I got about an hour flight. I'm happy about that. It'll be easy. So with that, I'm going to turn it to Nelson, let him kick this thing off. And, as always, I'll ask questions as we go through this thing. But as the audience participation goes, I'd much rather ask your questions. So put those into the Q&A tab on your browser window, and I'll filter them into the discussion too. So Nelson, let's do this.
Heath, thank you. Thanks. I appreciate the invitation. It's great to be here with you and sitting around the fire, even though it's 74 degrees outside here in Nashville. And I want to thank you and Six Degrees for continuing to support our work at NextGen Benefits, the Ascend Conference, which is our 10th, if you can believe it, our 10th annual Ascend Agency Growth and Leadership Summit. And for anyone in the audience listening, if you are into disruption, if you are into changing the healthcare system to help your employer clients and their employees and to differentiate yourself and grow your book and your agency, Ascend is where you want to come. We are the epicenter of this benefits revolution, and there are a lot of terrific and very, very effective solution providers like Six Degrees in our solutions showcase. Plus, you'll meet some of the smartest and most effective healthcare advisors in the country at Ascend, July 7th through 10th. If you're interested in looking up Attend Ascend, ATTEND, attendascend.com. All right, let me preface this as we can move to the next. Um, I want to preface this with, before I get to this particular point here, in NextGen Benefits, and by the way, NextGen is not an agency, it's not a health plan, it's a model. It's a model for employer-sponsored health plans. And it's based around self-funding, which is necessary but not sufficient. A lot of self-funded plans out there, and the employers are getting absolutely screwed. Self-funding is necessary because you can take control of the health plan when you're self-funded. But it's based on self-funding and managing the supply chain of healthcare. This is what the employees purchase. When you manage the supply chain properly, and fortunately, you as an advisor don't have to do that. There are incredible solution partners like 6 Degrees that will do the heavy lifting and the supply chain management piece. But when you manage the supply chain properly, not only can you control cost and lower cost, you can improve the quality of the care. So higher quality care, lower price. And that is what NextGen Benefits is about. In NextGen, we have a framework. The framework is Toolset. That is your solution partners. So 6 Degrees would be in your tool set. It's your plan designs, it's your plan docs, it'd be your consulting agreements, your tool set. It's the easier part to put together. It's the easiest part to do. Tool set, skill set. Well, how do you use those tools? When do you use those tools? When is it right to put in a pre-built small group self-funded plan that uses level funding? When's it right to do that? And when's it right to build an unbundled plan and bring in your TPA and your PBM and your RBP partner, et cetera? Well, that's part of the skill set, knowing when to do that and how to do that. But a bigger part of the skill set is getting the sale. This is a sales business. It's a sales game. If you can't get a buyer, an employer to say, yes, bring in a new health plan. I'm going to put you in charge of a health plan. If you can't get that yes, your tools sit in the van. You don't have any opportunity. So at NextGen, we really focus on consultative selling, self-funding, being able to explain it and debunk the myths about self-funding that keep most employers fully insured. They're scared. Selling the C-suite. I'm going to talk about that in just a minute. And then finally, managing the supply chain of healthcare. So the skill set is about, in large part, getting the yes, getting the close, so you can implement these strategies and improve the client's healthcare and lower the cost for the employer and the employees. Final piece, tool set, skill set, mindset, is do you have the right mindset? We're doing a session at Ascend, Ryan Miller and I, called Iron Sharpens Iron, the inner game and the outer strategies of elite advisors. And you've got to have your mindset right, both around what you're going to be doing, how you're going to be doing it, but that you belong, that you know how to do what you do, you're confident, et cetera. Today, I'm going to be talking about skill set, and particularly around the skill set of getting the sale, getting the yes, so you can bring in your 6 Degrees and other partners. All right, let me get basic here. This is the number one mistake that we see, and I work with advisors across the country, from Washington State down to Florida, from Vermont down to Los Angeles, California. The number one mistake I see these advisors making, well, not the ones who work with me, but I see advisors who are trying to do the right thing, is they're calling on the wrong buyer. You can see two doors in front of you there. Brokers live in the right-hand door. They go through the right-hand door. Successful advisors who are closing high-performance plans and helping employers take control of their healthcare plan are going in the door on the left, the executive offices or the C-suite. The C-suite is where the C-level executives, CEO, chief executive officer, chief financial officer, the CFO. You've got chief operating officer, chief technology officer, depending on the size of the company. But the CEO may go by president, may go by owner. But the CEO is whoever is really in charge, who has the final decision-making ability. The number one mistake is thinking you can get HR to have a strategic financial conversation, which is what's required to sell these high-performance plans. Strategy and finance happens in the C-suite. The CEO is largely strategy, the CFO is largely financial, but they both do the other. CFO does some strategy, certainly the CEO does some finance. Finance and strategy do not happen in the HR department. HR is an important strategic partner, but only after you've sold the case and you're starting to implement the plan. You can't leave HR out. In fact, we bring HR into the conversation before we get a final yes. But the initial conversation and the sale is made in the C-suite. So I want to make that point strongly because we started out calling on HR with strategies like RBP, medical utilization management, drug cost mitigation programs. And we got a bloody forehead from banging our head against the wall in HR. No, no, no. We learned that HR professionals are multilingual. They speak like 10 different languages. They can tell you no in 10 different languages. Yes comes from the C-suite. All right, Lindsay. Let's talk about how to speak in the C-suite. So when you're talking to an executive, you can't talk to them like you talk to HR. If you bring up elimination period or open enrollment or deductibles or anything like that, you're going to be back down the hall talking to Brenda in HR before you can say another word. The CEO and CFO doesn't care, and those are your targets. Ideally, both together, but either one. Eventually, you want to bring the CEO, CFO, and HR together once you've progressed along in the conversation, because the sale in the C-suite is a consensus sale. Very few CEOs will just make a decision arbitrarily. They're going to check with their CFO. They're going to check with HR. This is HR's chance to protect her friend, the incumbent broker, and kill the deal by whispering fearful, terrible things in the CFO's ear. And the CFO then goes to the CEO and says, we don't want to do this. This is not good. So it's consensus sale, but you have to have the language to be accepted in the C-suite. If you walk in and sound like a broker, the CEO and CFO have people to deal with brokers in HR. So the language they speak in the C-suite is a financial language. You can never go wrong remembering numbers are the language of the C-suite. They love data, but they also think about, lose sleep over, not the health plan, risk to the company. Where is their risk exposure? What are we doing for risk management? Understand that you as an advisor on the health plan are a risk manager. This is a major risk that companies take. We're going to pay for our employees' health care. Well, how much health care are they going to use? Now, you and I know that there are methods, stop loss insurance, for instance, primarily, that limits that risk. But that's part of the risk management process. But also, how do you reduce the risk of the cost of any specific claim that does occur? That's risk management. ROI. I think everyone knows ROI, return on investment. ROI is why they take risks, why they will make an investment, risking money, while they will make a change, risking noise, risking time, effort, disruption, because they see a return on that investment. They are going to reap more than they paid, regardless if it's money or time and effort. And then finally, retention of employees. This is absolutely crucial. If you will go research the cost of retention, I've seen numbers as much as 8 times the salary of an employee is the cost of replacing that employee. They're different numbers, they vary, but I've seen as much as 8 times. So you have a $100,000 employee you're replacing because they leave. It's $800,000 in cost. Now that might be a little bit high, but there's a substantial cost. Let's say it's 4 times. It's $400,000 to replace that one $100,000 employee. So retention is an issue near and dear to the heart, particularly of the CEO, but the CFO has to deal with the financial cost of that. So the CEO is responsible basically for culture, people, and numbers. The CFO is responsible for taking as much of the top line revenue that comes in and dropping it to the bottom line as profit. So he doesn't like to spend money on things that aren't necessary, like replacing employees who leave. Now, here's the thing. What you want to do is you want to reframe your conversation in terms and topics that resonate with the C-suite. So you want to talk about their business objectives. One of those may be increasing our retention, reducing turnover. Flip side of the same coin. We want to improve our retention because when we do, we know that it costs us less. Another, and it's not on here, but because it didn't start with an R, productivity. I couldn't find a word for productivity that started with an R. But productivity is another factor. Well, if you lose an employee who's been there a while, who's probably productive because he knows the job and he's effective in the job, and they leave, and you've got to bring in a new employee and get them trained up, where's their productivity? Well, it's in the basement. You've got to build that productivity up. More productivity means more profit for a company. So if you can talk about what you do around healthcare and around the healthcare spend, they don't talk about the healthcare plan. They care about what it costs them. The C-suite for that is spend, the healthcare spend. If you can reframe that in terms of helping them achieve their business objectives, and what are the executives' priorities? What is that CEO that we're staring at? What's on his plate? What are his pet projects that he can't get funded? But maybe you can help fund them. All right, Lindsay. When you get into the C-suite, there is an assumption, and it's related to what I was just talking about. That assumption is they care about how much money they're spending on their health plan. Well, of course they do. No, they don't. I can tell you why they don't. The only time they even think about it is around renewal, when they're faced with an increase on what they're spending. But you talk to a CEO or CFO in the middle of the year and say, I know you're concerned about how much you're spending on healthcare. They're not. They will tell you that in most cases. They've told our clients that. Why? Well, think about it for a minute. When is it in the year? Middle of the plan year. What have they been doing for 4, 5, 6 months, 7 months? Paying the premium every month. Has it been a problem? No, it's in the budget. We're not concerned about how much we're paying because it's a fixed cost. We're paying it. We're thinking about other issues, other topics. What are they? How do you know? You ask. That's consultative selling. That's half of consultative selling, is asking good questions. The other half is listening, and there are techniques to actually help you listen really effectively so that you can demonstrate to your prospect that you're listening. When you do that, when you can prove to your prospect you are hearing them and listening to them and understanding what they're saying, it develops rapport because we like people who pay attention to us. How many times have you ever said in your life, nobody listens to me? Heath, I know you said it. You'll pass down some memo to your team, and 3 months later, everybody's still doing what they were doing before. Nobody listens to me. True?
I don't know. They're pretty responsive to, but I
Well,
get
of
what you're
course,
saying. I
your
get what you're
team is,
saying.
and who would want to buck Heath Potter?
Exactly. Yeah.
But I will tell you, from the President of the United States down to the CEO of a small company, they're frustrated that people don't listen. At home, people don't listen to you.
Well, we're hitting on something. That's
Okay, there we
definitely
go.
the yeah.
Well, that's just true. You look at your kids. I mean, I have two kids. They're grown, but it's like Bo, my son, Bo. How many times have I told you? How many times have you said that? How many times have I told you? So when you listen, when you can show that CEO or CFO that you really are listening and hear them, it creates a bond. It's really powerful. But there's that one assumption that they are concerned about their health care or their healthcare cost. Neither is true. That is not what they care about. So if you make that assumption and you walk in, and my clients have done this, is how we learned this. I know you're concerned about how much you're spending on healthcare. And the CFO looked at Allison DePauli, one of our NextGen advisors, who she, eagerly awaiting her, yes, we are, because that was giving her the opportunity to launch into a conversation about controlling cost. He shakes his head, no, well, not particularly concerned about that. He then added, but I don't think we're getting the healthcare we're paying for. Well, if you can improve the quality of healthcare, you can have that conversation too. But what you really want to talk about is what they're concerned about, what they're thinking about, and it's not the cost of healthcare. So this is something I have spent hours on with our clients as in workshops and in discussions. We sell in our industry transportation. That's what we sell. It's designed to get you from point A to point B. Let's take a look at 6 degrees. What 6 degrees does is it gets you from, I've got a ridiculously high claim from the hospital. It's 400 times Medicare, 400% of Medicare, and a reasonable cost over here. A, B. How do you get from A to B? Transportation. How do you get to that island paradise that's on your screen? Well, you're either going to paddle there in a canoe or you're going to fly. Well, you might take a boat, but you're probably going to fly. That's transportation. But does anybody care about the transportation to, I think this is, Cayman Islands. Does anybody care about American airline flights from your city to Cayman Islands until you decide you want to go to the Cayman Islands? Well, of course not. Who goes online and looks up flights to someplace they're not interested in going? They don't. We buy the transportation because we want the destination. Nobody wants reference-based pricing. No, not a soul in the country wants reference-based pricing. Just like no one ever goes to Home Depot because they want a 1/4-inch drill bit. They go to Home Depot because they want a 1/4-inch hole. The drill bit's transportation. It provides them the hole. RBP provides you the cost savings from the high bill over here to the reasonable price over here. But until I understand I can go from high over here to low over here and understand what's involved in the trip from A to B, only then do I say, okay, so tell me about how do we get that done? Reference-based pricing. Do we have to do that in our company? No, we have a solution partner called 6 Degrees. Let's get them on a webinar. They can explain the process. But it's because they want the destination. They don't want RBP. They don't want 6 degrees. They only want 6 degrees when they decide they want RBP because they want the destination. Does that make sense? So the rule is 90% destination and talk about transportation 10%. Because when you talk about the transportation and they're not even understanding the destination or they haven't bought it yet, you're boring them to tears. They don't care. Oh, they may look like they're paying attention. We're good at that. But they are thinking about where they're going to dinner tonight or the golf game they've got scheduled for Friday afternoon. They're not listening. This is where you lose the room. You lose the room because you're talking about something they don't freaking care about. And they don't even care about reference-based pricing until they understand that that can get them their business objective. Okay, Lindsay. This is related. So let's say you've talked to that CEO and he's told you he has a pet project. He needs to hire a vice president of sales. He doesn't have one. He's got a sales manager, but he doesn't have a vice president of sales. And understand that the CEO is responsible for revenue, not personally. He's not out there selling, but the board looks to him. Why is revenue down? Why is revenue not going up, 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 up? That's on the CEO. So he looks to his sales manager or whoever's below him managing sales, running sales, chief revenue officer, VP of sales. This CEO has told you, I need a vice president of sales. And you go, oh, well, what would it mean to you to have a VP of sales? And he explains he's burning the candle at both ends right now. He's trying to be a VP of sales. He says, I don't know how to do it. I don't know what I'm doing, but I'm doing the best I can because my sales manager has told me he doesn't know what else to do. So I'm having to do it, but I'm also having to be CEO, but I'm not able to be as good a CEO as I want to be because I'm spending time doing something I'm not very good at, but the board is all over me. So what would it mean to get that VP? Well, I get my time back and I get to work on my CEO business. I get to do and be the CEO. I don't have to pretend like I'm the VP of sales. So it would free up a lot of time. Yes, it would free up a lot of time and make me a lot happier man. Anything else it would do for you? Well, it'll get the board off my back. They're wearing me out. They want more sales. They want more revenue. They want more because more revenue drops down to the bottom line as profit. They want more EBITDA, earnings before interest, taxes, depreciation, and amortization, EBITDA. It's C-suite for profit. The board wants more EBITDA, and they're on me to get it. I need this VP of sales. Okay, I understand. So you need the VP of sales to free up time, give you your opportunity back to be the CEO that you enjoyed being and you're good at, and it gets the board off your back. Did I hear you right? And you just heard, by the way, part of the answering strategy that we teach. It's called keyword backtracking. And we get into this in our NextGen Benefits Bootcamp. We teach this, do a lot of skills practice with keyword backtracking and consultative selling. And we'll be talking about a lot of this at Ascend, by the way. So you'll hear a lot more, much deeper dive at Ascend than we're doing here. So you've got that CEO. He's saying, I need a vice president of sales. Well, why don't you have one? Well, you can guess the reason. He said, oh, I already know who I'm hiring. I can't afford him right now. I don't have it in the budget. So you've got your candidate, but you don't have the money allocated. You don't have free cash flow to allocate to his salary. Yes, that's right. Thank you. You say. What's the cost? How much? And he says, oh, 250. Do you need the entire 250? Oh no, I've got 100. We've got 100 available, but I don't have the other 150. And I mean, I don't know where it's going to come from right now because he would have to come in and sales would have to go up for me to pay him. And that's a risk that, and if it doesn't work, the board's really on me because I made a hire I couldn't afford. So you need $150,000 available, knowing that money is going to be available for you to hire this VP of sales. Yes, that's right. The CEO says. Now, I don't think I have to connect the dots for you all. He has a business objective that he can't achieve because he doesn't have free cash flow. He doesn't have the revenue available to support that hire. You, on the other hand, can pull money out of the healthcare plan. Well, how much? Well, I don't know. It depends on the size of the company, obviously. How many employees? How much are they overspending? If their per employee per year is 17,000, oh, you can save them a lot of money probably over the next 4 years. You can get them down to $6,000. That's $11,000 per employee per year over 4 to 5 years. But even in the first year, you should be able to pull $2,000 per employee out. That would be savings for the employer. But read what is in front of you on the screen. Never use savings in a conversation with the C-suite or HR for that matter. Why? Think about it for a second. Why? The answer is because every broker in the market that calls on this employer, and they call on them all the time, trying to get the business, will say, I can save you 10% on your health care. I've got 10% savings for you. There's 10% savings that we can create for you over and over and over again. And they can't. They don't. They save the employer 10% spend for them, for the employer. The employers cash out, but they put it onto the employees. It's cost shifting. Well, they're not lowering the cost of healthcare. They're lowering the cost to the employer, but there's a price for that. How many employees are happy when they have an additional, an addition to their premium for the next year? It's one of the biggest complaints employees have. I'm already paying this. Now they're going to make it this. There is a morale cost, and morale and productivity are closely linked. When people are not happy in their job, their productivity goes down. That costs the company. So the broker who comes in and says, oh, I can save you, there's 10% savings, isn't taking into consideration the cost of shifting that 10% to the employees. They don't believe savings. They don't believe it. They just think it's cost shifting. Don't use the word savings. Instead, talk about creating a fund. Because you're going to take the money, the overspend that you're pulling out of the healthcare plan, and you're going to put it in a fund, a discretionary fund. Think of it as a bucket, a discretionary or an account that the CEO can access. I wouldn't call it a slush fund, but the CEO might be thinking of it as a slush fund. Whoa, that's money that's off the books, kind of. I mean, it's not allocated. It's free cash flow. There's another term, by the way, free cash flow. That is catnip to a CEO. Free cash flow is your discretionary budget dollars. End of the month, you paid all your bills and you've got $280 sitting there. You've already put your money in savings for the month. And you look at your spouse and go, what do you think about a quick weekend away? We've got the money. Or how about a big splurge dinner? Or do you want to go to that show we've been talking about? It's coming to town. Because you have the free cash flow. You have the discretionary dollars. If you will talk to a CEO and a CFO, but it's the CEO's discretionary fund, the CFO will be happy because he doesn't have to go find that money in the budget for the CEO. When you talk about creating a fund, that is extremely attractive to a CEO or CFO. Don't use the word savings. Use free cash flow and fund. Hope that makes sense. All right, Lindsay. I'm going to go back and talk about some of the other things, but I wanted to get these main points out of the way. And then Heath and I can have some conversation and we can answer some questions. But I promised this, and I promised Heath I'd talk about this. Too many brokers sell RBP, reference-based pricing. If you're on a 6 Degrees webinar, I'm pretty sure you know what RBP is. But just in case, RBP, they sell RBP as a, well, first of all, as a transportation. Now, of course, then nobody buys it. If it's just transportation, nobody buys it unless they bought the destination. But it's generally positioned as a cost containment mechanism. Well, that speaks to the health plan. But if you, again, reframe that and show the, and by the way, this is a B-21 strategic bomber. So that's why this bomber is here. It's a strategic weapon. This is part of a strategic military plan. You send the bombers in, you soften up, you destroy strategic targets, you soften up strategic defenses. The way to help an employer, a CEO or a CFO, understand that RBP is extremely valuable to them is to help them understand it's a strategic tool that they can deploy. It's a lever that they can use to increase the size of their fund. It's not about saving them money. Remember, no savings. 86 savings. If anybody's been in the restaurant business, 86 means kill it. Kill the order. Don't use savings. If you talk about, at some point, if you say, I'm going to create a fund, and that fund will allow you to hire your vice president of sales, because I can assure you that as we go through the year, there is going to be savings to your plan. You can use it that way, right? But don't say I'm going to give you savings. That there's going to be a reduction in the cost of healthcare that's going to produce this fund at the end of the year. But it's available throughout the year. You don't have to wait to the end of the year. That money is you're not spending as much as you would otherwise. So he knows, CEO or she knows that she'll have that money available to pay that vice president of sales, which is their business objective. Now you're talking their language, and RBP becomes a strategic tool that they're using. How are you going to create this fund? Well, there's overspend in your healthcare plan. What do you mean overspend in my healthcare plan? 30%, 25 to 30%. The study showed 25 to 30%. I often use 30 because it's a very credible survey, credible study. 30% of healthcare costs are fraud, waste, and abuse. Fraud, waste, and abuse. Is there any reason to believe, Mr. CEO, that your health plan is exempt from that 30% number? Well, probably not. So we're diving into that plan that you have, and we are going to pull out some of that fraud, waste, and abuse. That's where the fund comes from. Well, how are you going to do that? This is akin to, I just sold you, it's January in Minneapolis, or it might be January in Portland. I don't know. How much snow do you get in the winter in Portland? You get a
Not too
lot?
much.
Not too
Yeah.
much? Okay. Go north.
A dusting to a
Yeah.
couple
Okay.
inches
So
sometimes.
let's go to Minneapolis, where it's damn cold and there's a lot of snow on the ground and it's messy and troublesome, and it's January and the snow is out there and it's -4 degrees. And I'm talking to you about the Cayman Islands. And I'm talking to you about a resort in the Caymans. And this resort has the best mixologists in the Caribbean. They've got a Michelin star restaurant at their hotel. And the week of February the 3rd, they've got a 50% sale going on. I'd like to go, the CEO says. How am I going to get there? I've never been to the Caymans. How do I get there? Well, this is where you tell them about the transportation. Oh, it's easy. American Airlines flies direct from Minneapolis to Miami, catch another American flight direct to the Cayman Islands. Easy, easy peasy. The CEO goes, oh, I can do that. Sounds reasonable. So when you say, I'm going to build this fund for you, and they say, where's it going to come from? Overspending your health plan. How are you going? That's fraud, waste, and abuse. How are you going to get that fraud, waste, and abuse out? Well, let me talk to you about one strategy known as reference-based pricing. Explain how Medicare is the basis. Hospitals pay, accept Medicare reimbursements every day for all manner of procedures. And yet and you should do your research. What are hospitals in your market generally charging? Is it 200% of Medicare, 300, 400, 600? I was at an Ascend conference a few years ago, Heath, and I was talking to an advisor out of Tampa named Patrick Thornton. And we were having a cocktail at the reception. And I said, Patrick, you've got to keep doing what you're doing. We've got to keep the hospitals from charging 400, 600, 800% of Medicare. Patrick's shaking his head like he doesn't believe me. I said, no, Patrick, we've got the data. The hospitals do that. He goes, oh, no, I was thinking 1,000% of Medicare. I said, well, I never heard 1,000%. He goes, yeah, I was the CFO for a HCA hospital. I wrote the charge master 1,000% of Medicare. So what is, and the RAND Corporation study, and I know you're familiar with that, Heath, the RAND Corporation study of what hospitals are charging, the markup they're charging commercial plans, their employer-sponsored plans, is phenomenal data. And they've updated it, I think, 3 times now. I think they're working on the 4th update. So go and look and see what the average is in your state. You might even find hospitals in your market that were studied. And you can say, St. Mary's charges 500% of Medicare. Do you have a 5 times, do you have a 500% profit margin? The employer goes, of course not, 10%. Well, can you afford to pay the hospital 500%? That's absurd. So reference-based pricing uses the Medicare reference to negotiate with the hospital down to a reasonable markup for the hospital so that you don't have to pay that outrageous markup.
Yeah. I'd add, Nelson, that, for the advisors that we're working with, they get access to our MetaV analytic tool, which allows you to look into, you can look at it market based, you can look it down to procedural based and see, what is being charged from a Medicare multiple and the underlying cost components that go into it. So it's very valuable for having those discussions with, the C-suite and helping them understand how they're being taken advantage of under a traditional top-down type model.
I apologize. Of course, I know MetaV. In fact, I've been given access to that. Thank you. It's very, very useful. It is a tremendous tool. Actually, I think it's one of the great differentiators that you all have to be able to provide advisors with that data. But if you just walk in and say, hey, by the way, CEO, you're paying 400% of Medicare for all of your procedures, most of your procedures from the hospitals around here. Now it gets contentious. Well, that sounds ridiculous. That's too high. I don't believe that. And you get into this basically an argument with the executive over a fact. If you start with, what are your business objectives? I can help you with that one because the reason they're not achieving it is money. I can help you with that one. How can you help me? I can create a fund. Are you serious? Where would the money come from? Overspending your health plan. At that point, that CEO goes from skepticism, doubt, too good to be true, to your champion. Why? Because he wants the health plan improved? Absolutely not. He wants his business objective. Give me my vice president of sales. Now it's what do we need to do to get my VP of sales? He's not fixing the healthcare plan. That's what you're doing. He is facilitating you, providing him with a fund to get his vice president of sales. It changes the dynamic dramatically. Now, when you explain RBP as a strategic lever, he's going, how often can we do this RBP thing? This sounds fantastic. Because it is not an end, it's a means to an end. And the means to the end is not to get savings, it's to help that executive achieve a business objective that is important to him or her. I hope you see the difference there. You want to change their health plan because that's what you do. They don't care, but they would love you to help them achieve a key business goal. If you talk in terms of that, then when you bring up RBP, you show how it's one of the levers that they have to pull. It gives them power. There's a whole nother presentation. I don't have time to go into it, but there is one thing executives control, one thing all executives crave, control. They want to control everything. They want to control when their employees take restroom breaks. They'd like to, they don't, but they'd like to control everything because then they know the outcome. When you can show them how they can take control of their healthcare plan in the service of achieving a business objective, they get excited. It's like, I didn't know I could do that. Yes. And that's how I'm going to get my vice president of sales. Yes. Let's do it. Hope that makes sense. So with
It does. Hey, Nelson,
RBP,
there's a couple comments / questions that trickled in here on that last slide. I'll run them by you, and I might add something to it as well. But one of the questions: how do you feel RVP compares to episodic based care?
compares to what?
Episodic based care.
Well, I think it's apples and oranges. Uh,
Yeah, the way I was sitting, I had a little more time to think about that as you were talking. The one thing I would say for RVP, it's probably the single most cost saving initiative you can take from a reduction in claim cost. Now, does it come with things that we need to consider? Absolutely, yes. Balance billing, probably the biggest thing as of old. I think that has been primarily addressed through whether you're using a 6 degree solution or somebody else's. I think people have gotten a lot better at handling the balance billing. What comes next is access. That's kind of the new frontier. And I think this goes into one of the other questions that's here as well, is that you've got to have tools in your belt as an RVP vendor to handle whatever comes at you. And what is the norm today in one market may change tomorrow. CFO of the hospital system changes. Balance billing is no longer an issue. Now access issue is the issue. So you've got to have a partner that can handle those things. And I would say the episodic component of this plays out within at least our RBP strategy, where you end up doing contracts around a specific event to get people care. You've got to have a talented team to do that negotiation and set it up appropriately. But that's how we address some of these things as they come up. So I don't know if you've got anything to add to that, Nelson.
well, that's actually well addressed. The reason RBP exists is bad contracts between the carriers and the providers. The carriers allow these outrageous markups on Medicare A direct contract fixes that. You're still always going to need reference-based pricing for out of network claims or non-direct contract claims where somebody's, let's let you were just on the East Coast. If you had an accident, had to go to a provider over there, you wouldn't have a direct contract. And you might be able to generate one quickly, but if it's emergent, you're not going to. Okay, no, stop the bleeding, but let me get on the phone and set up a direct contract, Heath says. Don't take me into surgery just yet. That's not going to happen. So RVP is always going to have a place. It's a valuable, valuable tool. Uh, when you can go in and do a single case agreement, but I mean, I'm seeing more and more of that within the RVP model. And I think this is where RVP has really evolved. RVP used to be, for better or worse, at least in the original iterations, it was a bit of a meat cleaver. It was sort of, boom. Wasn't the scalpel. And companies like 6 Degrees and a few others are getting very, very surgical, to use a pun there, around addressing the cost of care. So it's not just, oh, bill, we're not paying that bill. We're sue us if you have to. I mean, that's the old model. There's a lot more nuance and a lot more tactics, a lot more strategy going into it today.
Sure. Which I think carries into that the last question that's on this comment page about hospitals in a certain market not allowing third point of service. I think this goes back again to having tools in your belt, making sure you're working with a vendor, including, and you got to take in consideration the TPA that you're working with as well, as they're going to play a part in this. But making sure that they can pivot. If you got to get people in the door, do they have access to technology that helps drive the member to the accepted locations or the contracted locations? If not, are they going to be able to contract in a timely manner, to get them in the door? Is there a physician only network that's involved with this? What components does that play? So those are all things you have to consider. I know that under the 6 Degrees model, we do a lot of contracting to address these difficult marketplaces. One thing to consider as an advisor as you go into markets, contracting oftentimes is not quick. You can do single case arrangements quite quickly, but if someone's promising you a global agreement, don't expect that to happen overnight. That's something that could take a year to get in place. So you've got to have ways of getting access while those things are being developed.
Well, and plan design plays into this too. We've got a session at Ascend that's going to address this, but when the plan design incentivizes the employees properly. So go to these high quality providers, and we waive your out of pocket, waive your co-insurance, no co-payments. It might require and this is where a good medical utilization management company comes into play, because they will work with your RBP vendor. They know which are the no-go zones, which hospitals are not RBP friendly. And so they can immediately tell the employee, you could go to St. Mary's, but you're going to pay your full out of pocket, which would be what, $9,400 potentially. Or you can go 40 miles down the road to this hospital, and we're going to waive your out of pocket entirely. And if you get that information to the employee early enough, and they've got the financial incentive involved, most employees are going to make the right choice. They're going to take the right option. So a lot of it's your partners, a lot of it's plan design to make sure that you're giving your RBP vendor every advantage. You don't want to put them in a situation where everybody wants to go to ABC Hospital. The problem is ABC Hospital has said no RBP. Well, how do you change people's minds about going to that hospital? And financial incentives are a very, very valuable and effective way to do that. So plan design, other strategic partners within the plan.
For sure. Um, You got any other thoughts here? I've got a couple questions myself, but I don't see any other audience questions at this time. We've got a few minutes left here before we wrap up.
No, hit me with your questions.
All right.
I'm curious.
So, uh, the one of the things that I see is are folks just they're they're kind of stuck in what they've been doing. They have a hard time breaking away, as you would say, away from the status quo. Um, what is what's the elevator pitch you'd give to that advisor to say, hey, it's time to look at doing something different?
Well, uh, it's really more about the destination that where they could be. So our industry has commoditized brokers. There's very little you can do to differentiate yourself. Very little to meaningful. Well, we have some additional technology. Well, you don't think your competition can go to get exactly that tech if that's what's keeping them from, if that's what'll keep them from losing the account, right? It's really difficult. The plan designs are fixed by fully insured plan designs are fixed. The costs are pretty much the same from broker to broker to broker the quote you're gonna get. The quality is what it is. How do you differentiate yourself? Differentiation comes from selling differently, consultative, being able to move that client, that employer, not client yet, move that employer from fully insured to self-funded. But you've got all sorts of myths that have been spread by the insurance companies and by many, many brokers about, oh, it's too dangerous. It would bankrupt your small company. Small company, it's a $50 million company. Well, but yeah, but could you absorb a $4 million shock claim? No, most companies couldn't. So being able to sell self-funding, overcome those myths and get a yes on self-funding, and then being able to deal with the C-suite. Here's the thing. You call on HR, or let's say you get into HR to talk to them. If they're talking to you, you think they're not talking to other brokers? They're obviously looking to replace their incumbent. It's a revolving door in HR. Brokers in, brokers out. They're all calling on. You go to the C-suite, Heath, it's blue ocean. You are there by yourself. Nobody else is up there talking to them about eventually changing their health plan. So you're differentiated automatically. And then if you're doing consultative selling, which you have to do with the C-suite, it's not a product sale, it's a consultative sale. If you know how to convince them that self-funding is safe and smart, and if you can show them that you are able to build that fund, which is managing the supply chain, then you are going to do what NextGen advisors do all the time. They're winning bigger mid-market groups from bigger, even national brokers. And have you seen this? I've got a litany. I show the advisor the name of the company, his name, her name, and the agency brokerage they've taken, how big a group from. Because it's important for these advisors to understand when you're using the right strategies, calling on the right buyer, and using the right language, you can win business you should not win as a small independent agency. That's what I tell them. The outcome, it's the destination. Do you want to win bigger mid-market groups from bigger, even national brokers? Then you have to change what you're doing. Otherwise, you're going to be getting the same results you've been getting.
It was good stuff, Nelson. Bill Stevens made a nice comment in the chat section here as well. So I really appreciate having you on. It's been great. And for those in the audience, there's Nelson's contact information. And again, his event, if you haven't been to one, Ascend, is in Salt Lake City this year, July 7th through 10th.
Attendascend.com, attendascend.com. You can come and see Heath personally. Tell him how much
That's
you
true.
appreciate
I
what he
will
does.
be there. Hopefully, even more tan. Get a little Fourth of July event in on the out in the river, and then join you all in Salt Lake. So appreciate having you all attend today. It's been fantastic. Nelson, phenomenal job. I'll have to
Thank
have you
you.
back here soon. And we'll see everybody else on the next Fireside Chat. So it looks like we're going to take a little vacation in July and be back on August 20th. So we'll see you there. Thanks, everybody.
Appreciate it.
Take care.